All right, guys, we're doing a podcast today. I got a great guest on. His name is Dr. Grover, and I'm actually going to have him just introduce himself real quickly.
Sure. So, Dr. Wadehra, thank you so much for having me here today in your beautiful office on a sunny day. It's not very often we get those
Right.
in the winter, so got to appreciate that. My name is Keshav Grover. I'm a integrative and functional medicine doc here in Bloomfield Hills, Michigan. My wife and I live here in Birmingham with our daughter. I'm very passionate about helping people to feel the way they want and to also look the way they want, and that's also where our Med Spa Aesthetica by Grover Health also comes into play in our practice to really help people to live their best life in terms of maximizing their potential on a daily basis.
No, I love that. And we need more docs like yourself. And we're going to dive deeper in this podcast, but um, not to jump to anything just yet, but I love that, we're starting to see more functional medicine, especially in the Detroit metro area. And correct me if I'm wrong, it's pretty big in the bigger cities like LA, Miami, New York. But it's nice to start. It's nice to see that coming to this area because functional medicine I think is so underrated currently. And you and I have had some conversations, on the phone about this, but not to dive too deep just yet. But I'm excited that you're on this podcast. For those of you who don't know who I am Dr. Wadehra. I practice minimally invasive foot surgery and regenerative medicine. I was born and raised here in Metro Detroit. I was with an orthopedic group right out of my fellowship for a few years, and I decided one day that corporate style medicine was just not my thing, and I really wanted to bring more of a holistic, functional approach to foot and ankle surgery, and that's when I started this practice right here, the Art of Foot and Ankle, right here in downtown Birmingham. So Dr. Grover, tell us about what you do. What is it that what ignites your passion about what you do, and how is it different from, let's say, the guy next door?
Sure. So, in a traditional conventional medical model, I think the first thing that's worthy of saying is that I think every doctor, anybody who provides medical care for people, practitioners, they're doing it because they care about the patients. So it's not about being better. It's just that in traditional medicine, where you're dictated by the insurance companies and doctors have this pressure to see X number of patients per hour and chart their charts a certain way to generate a billable code to be paid, that's a much different interaction with a patient. That is a system-wide kind of approach where you're treating everybody the same way, and it's almost like everybody gets the same meal. And the truth is that there's people that want something else on the menu oftentimes, that maybe some things that are not on the menu that they want to discuss as well too. And so that's where I think practices like mine, practices like yours come into play in terms of allowing us to actually figure out what is the root cause of our patients' issues, not just knee-jerk reactions to symptoms like hypertension or high blood pressure, diabetes, high blood sugar, cholesterol, or even things like autoimmune diseases or gut health conditions, or even if somebody looks in the mirror and is concerned about fine lines and wrinkles, how can we help that person from both a external approach, that's where like my med spa comes into play, and I am blessed to have a great team to help our patients to achieve those goals, but then also to have that conversation about how that person's gut health is, how that person's hormonal health is. Are they having something as simple as like a bowel movement every day? I mean, it's shocking how many people are constipated that you would expect people to say, yeah, I have a bowel movement every day in the morning or some point in the day. And some people will say, well, I have one every Wednesday. And it's like almost like, oh, okay, this is like a weekly event for this person. So
And they normalize that.
yeah,
It's like, oh, I thought that was normal.
exactly. And it's shocking also that PCPs aren't helping that person as much as they could be if they were given the time by the insurance companies to say, hey, listen, you spent an hour with this person and you've helped them with their gut health. You've helped them to optimize their microbiome, which then has a downstream effect on helping their metabolic health, their cardiovascular health. We're going to reward you with that hour. But that's not how our system is. Our system is that if you spent an hour with that patient, you're actually dinged by the insurance company because now you haven't seen more people for them to bill.
Right.
And so in our model, we give our patients 60 to 90 minutes when they come in for an intake. Our follow-ups are at least 30 minutes because we want to make sure that we are addressing their issues, not just now, but also as we see them throughout the course of their time with us as patients, to make sure that we are able to make changes even on the fly with their plan. Or oftentimes we'll have patients that are traveling, or executives, they're going to restaurants, they're looking at menus, and they need to know what can they eat when they're in those situations. And that's where we're going to help them to do that, to focus on the principles in terms of things like whole foods, plant-based eating, or plant-forward eating, meeting them where they are in terms of their, like, let's say they have food preferences or food requirements per their faith. We're going to make sure that we're meeting them where they are in their journey to getting better. And so I love when I'm able to see patients come in, and whether it's on the aesthetic side or the functional medicine side, or in some cases we have a little bit of a Venn diagram where patients are patients of ours on both ends of the practice, and we're able to really see them come in and make a lot of changes in their well-being because they are investing in that process. They are able to invest not just financially, but also time-wise in terms of they're able to eat better. They're able to work out or exercise or move or take the supplements that we recommend and do those simple tasks on a daily basis, or even after you come in for a treatment on the med spa side. Are you using your SPF? Are you using your skincare? Are you checking in with us in your 2-week follow-ups to see like how the procedure went? Is there something else that we need to do for you? So the people that are motivated, the people that are willing to invest in their well-being, they're the ones that are able to experience their best life because now they've spent the time with us, we've given them the tools, and now they're able to have that experience. So that's kind of I know it's a mouthful of what I said from your question, but that's kind of a snapshot of what we do.
That's awesome. And I think that, if patients are watching this, I still feel like there are patients that don't even know that you offer, we have these services available, right here in Metro Detroit, and no, correct me if I'm wrong. You're a direct care, right? You're you're concierge type of practice.
Yeah, we are a direct care. We do work with individuals in terms of their FSA or HSA accounts. We can give them a super bill for them to get reimbursed by their insurance company, but we do not bill their insurance company directly.
So right now, in our country, we know insurance is in shambles. And maybe, a patient's watching this and they're not understanding what I'm saying right now, but we're also seeing a big shift in, private practices almost shifting over to this direct care model, this concierge model. You're doing it. I'm not a concierge. I'm what we call a hybrid concierge, where we take insurance, but we also offer other modalities that, in my opinion, and you can even ask my patients' opinion and my colleagues, where those services that we do offer that are not covered by the insurance tend to be better for the patient. And we'll dive deep here in a second. But can you just very simply define what is a concierge model? What is a direct patient to doctor relationship? What does that mean in your practice?
Yeah, and I think that there's a few distinctions. So there's one concept of direct primary care, which is more of like a concierge PCP or primary care model, which we are not.
Like MDVIP. MDVIP.
Yeah. Okay. We are not MDVIP. We're not, because our specialty is more on the longevity piece, and we like to kind of focus there. I have thought about adding that and getting another provider to help with that part of the practice because we have a demand for it within our patients. They ask me all the time, can you be my PCP? And, while I could, but I think that it wouldn't, then I would be distracted by keeping up with a lot of the things that I think the PCPs actually do really well. Like if you see a good PCP that's making sure that if you're a woman, you're getting your mammogram done at 40 every year, you're getting your PSA done as a male, you're getting, which is your prostate testing, you're getting your colonoscopies or pap smears, you're getting your immunizations that you require at the right time, you're meeting those benchmarks that PCPs should be really looking at, or doing a urine analysis every year, looking at your metabolic numbers, making sure they are where they need to be. PCBs are great. I think, they're the frontline kind of foot soldiers in terms of combating disease. And the really good ones that have good training and that, also have an interest, they're also exposing their patients to concepts like nutrition, to plant-based approaches, to fitness, to resistance training, to yoga, Pilates, all of the things that we know that what we practice are very beneficial, but the really good PCPs do talk about those concepts with patients. So we are not DPC. We are more of we do have memberships. So with our members, we do act as kind of a concierge service with them, but we can also see patients a la carte. We find that when patients do become members, then they have more success because now we have regularly scheduled meetings with them where I'll meet with them at least 1 hour every month. And sometimes we'll even split that hour into 2 30-minute sessions. So I'm meeting with you like every couple weeks, or even for some people that need a little more hand-holding, we'll meet with them for about 15 minutes or so every week, just to do a quick check-in to say, hey, how was the plan? We talked about this last week, and this is where even my dietitian and health coach and Dr. Arti Surya, who's my associate in the practice that also helps takes care of patients as well, where we can actually then make changes on the fly, or at least create realistic expectations where somebody's like, hey, listen, it's Thanksgiving week. I'm going to have a lot of family over. I may not have time for my 3 to 4 workout sessions this week, or I may eat a little bit more than I anticipated. Okay, fine. That's understandable at that time, but we can also help them navigate through that. But in terms of our model, though, it's patients come in as new patients, and then we kind of have a discussion, and then we determine, are they somebody who is more of a consultative patient where maybe we need to just work with them for a short period of time where it may not make sense to enroll them in the membership, or are they a true member where then they have a laundry list of issues, or they have 1 or 2 issues, but we know that they're going to need that hand holding through the process to get there. And so that's where we see a lot of success in our membership. And we also have an aesthetic membership too, which also saves patients money on their treatments as well.
Well, that's great. So it sounds like, everything's customized for that patient. It's not cookie cutter. Is that right?
100%. It's almost like you could, equate it to, like, for example, we're both wearing scrubs. You can choose the size, you can choose the cut, you can choose how many pockets, you can choose the color of the drawstring, you can choose, all the sorts of options on that. And it's the same thing with our plans. We are very much so about you. So if you came in, it'd be the Wadehra plan. Mm-hmm. It's not about the Grover Health way. It's about you. That's why in our practice, you won't find any kind of pamphlets or materials that say the Grover Health method, or the pillars of the Grover Health way, because that may not actually meet where the patient is. We have patients who are coming in that are in their 20s, and we have patients who are coming in who are in their 80s. And, if you're male or female, in fact, even we do treat some transgender individuals too. Mm-hmm. So it's not one size fits all. It's really about where that patient is mentally, physically, emotionally, spiritually. All of those components have to be appreciated in the plan.
And it's interesting, right? Because when you first enter medical school, you take an oath, right, to provide the best treatment solution to your patients. That's the oath we all took, right?
Correct.
As providers.
Yeah.
And we kind of highlighted it a little bit ago about how insurance the traditional model. And again, if patients are watching this, I mentioned that our insurance right now is kind of in shambles. And I use that example. Unfortunately, the CEO of United Healthcare was assassinated by a patient. But we took an oath to help our patients. Unfortunately, a lot of providers, especially in private practice, are dictated by what the insurance will cover, right? A lot of times there's a plan that would probably work for a patient, but you probably don't even bring it up to the patient because one, that's not covered by insurance, but also you're afraid to talk to your patient about, hey, look, I think this is better for you, but it's not going to be covered by insurance. And so, us as physicians, we weren't taught business in medical school, right? But what we were taught was at least we took an oath to help our patients, provide them the best treatment solution, regardless if it's covered by the insurance or not. Why do you think? And this is a loaded question, and there's no right or wrong answer. But why do you think our insurance is in shambles right now? Why do you think that? Is this not? I don't know what the right answer is, but we need more. We as providers need to be okay with offering our patients the best treatment solution, regardless if it's covered by insurance or not, because we can help a lot of people.
Yeah.
From a preventative measure, you look. Am I right with the statistic? 1 in 3 will become diabetic.
Yeah, I mean, I think it's even getting closer to 1 in 2 or so.
It's crazy.
And I think that, to kind of answer your question about insurance, look, I'm not a CEO in terms of like Wall Street level. I'm a mom and pop shop, and, I've had to learn a lot about entrepreneurship myself, just like you have. And I know we've had conversations about that. And I think that the insurance concept, just from my understanding, is the insurance company makes money by getting premiums every month from individuals. Like even if you think about life insurance, you think of disability insurance, these are all basically rainy day funds that in case something happens, like, for example, like what happened in California with all the fires, God forbid that ever happens to any kind of community. I mean, my heart bleeds for those people.
Yeah.
But if you think about it, what happens is now, like, the insurance companies, some may reject paying because of the extent of the damage. Some may not pay because they don't have the funds to do it. Or if you look at it, they're hedging their bets that somebody will not get sick as in health insurance, right? That somebody will not use their service. So the premise of insurance is that you keep paying us, and then when you get sick, we will quote unquote take care of you with a little asterisk. And then if you look at that asterisk, it's more like, well, we're going to try like this treatment first. And then if this doesn't work, then we have to go to the next treatment. And if this doesn't work, then we go to the next treatment. And there's some arguments that can be made about the fact that maybe some docs do order too many imaging tests for patients, which are expensive, or that, you're doing too many invasive procedures that are expensive inherently. And I get that there are bad apples in the barrel in terms of there are practitioners who have taken advantage of insurance and said they've done procedures and did order testing and got paid, and that's unethical, right? And that does affect us all. But at the same time, when you look at it, I know what I pay for insurance every month, and I'm like, well, I could have an Airbnb condo for that, and be making a lot of more money on that. And I think the point is that from what I do, actually, if you look at beyond the testing, which is actually the majority of the money that patients will spend in my practice on the functional and integrated medicine side, it doesn't cost anything to breathe the right way, right? Doctors don't teach their patients how to breathe. The very fact is that we're all taught that we breathe with our chest, like where you expand your chest. But actually, if you look at it, you should be breathing with your belly, where you're actually filling up more of your chest cavity with oxygen, which can then also make your parasympathetic system work better. So now
less anxiety.
You're less anxious. You're more relaxed. And your digestion improves. Your blood flow improves. I mean, heck, even for some people, their sexual function improves. Think about how many people
just by belly breathing.
Just by belly breathing, because now you are activating the vagus nerve. these concepts don't cost anything.
Right.
So for a lot of what we do, like even for somebody to say, hey, you should be eating whole foods, go on a whole foods diet for 30 days, see what happens. Do not eat any McDonald's, don't eat anything in a package. Make everything that your great grandmother or great grandfather or would eat, right? Just do that for a month. See what happens. It doesn't cost more, like
Right.
some people will go and invest in a handbag. That's a few $1,000s.
Sure.
Or some people might go and invest in other things to make themselves quote unquote feel better and then rely upon these expensive medications from the insurance companies or have to go to the hospital. And, if we really do a good job on the primary care side of things as physicians as a whole, then we are able to prevent those things. Or for even certain simple things. This probably better than I do. What is a mortality rate of somebody who gets a hip fracture?
Oh, it's pretty high. So right now, if I haven't looked at the literature in a while, but there's a 20% chance of of dying in the hospital after a hip fracture after the age of don't quote me on it, 75, 80. That's my grandma.
Yeah,
right.
Exactly. And so, but we know that resistance training at a young age improves bone density. We know that resistance training also improves muscle tone. Resistance training also improves posture and prevents falls. So why isn't resistance training taught in medical school as a preventative method to prevent something like a hip fracture?
Right.
I'm not even talking about something like cold plunge, infrared sauna, or a whoop, or a Oura ring, or something. Yeah, there you go. I'm not talking about anything advanced. These are basic fundamentals that don't cost anything.
Primitive stuff.
Primitive stuff that our ancestors have been doing for decades. That we've forgotten about this person has low bone density. Let's put them on a medication to increase their bone density, which then has a whole host of other side effects.
Yeah.
But why aren't we talking about the basics principles that actually don't cost anything? So when it comes to insurance, an insurance provider won't reimburse. Let's say you're a physician and you have a session with a personal trainer in your office for your patient. They may or may not reimburse that, but they'll reimburse you for seeing 4 patients and putting them on pharmaceutical prescriptions.
Yeah.
Right. So it's more of the priorities of these companies, and I think they're slowly, very, very slowly waking up to the reality that things are changing. Not to make this a political conversation, but I think it is interesting to see with individuals like RFK Jr., if he gets confirmed, what happens to the insurance companies? Will they then have to start to reimburse people like you and me a little bit better? Or even somebody like a personal trainer who's working with somebody who has a history of low bone density and may need that work to be done.
Right.
Rather than just giving writing the checks for the pharmaceutical companies, which are making billions of dollars on our dime. At the end of the day, what we do is not that expensive if you think about it in terms of prevention of disease or better ways to mitigate the negative impacts of diseases overall.
I 100% agree with that. And politics, no politics. I mean, I just read a statistic that by 2030, the average deductible will be $10,000. And, I was just having this conversation with another doctor last week, and, patients still need health insurance. We still need health insurance. Why? Because tomorrow, if we're in a devastating car crash, that's going to help save our life, right? Cancer diagnosis, something of that nature. But, when it comes to preventative measures, more like elective type stuff, I don't know if health insurance is the answer. It's going to cost the patient probably a lot more in the long run versus a direct care. And that's where I'm seeing a lot more direct care type of model now amongst dentists, especially on East Coast, West Coast, but even Bloomfield Hills, Birmingham, some of the dentists are pretty much no insurance anymore. Why? Because they can spend the time with the patient the way they want to, provide them the best treatment solution, and not have to worry about the middleman really getting in the way of how to treat the patient. And that's, again, that's why I went to school and, I do what I do. And that's exactly why you started your practice. And so there needs to be a sort of a wake up call. Again, I'm seeing it in my practice. Patients are already becoming savvier with their sort of insurance, in the sense that they already understand that, look, this may or may not be covered by an insurance, but I know this is what I want because, you just treated my friend Mrs. Jones and she's doing fantastic with that laser therapy. Or, hey, patients are starting to walk in now and say, hey, I know you offer this orthopedic biologic injection. I know it's not covered by insurance, but can you tell me a little bit more about it? Because I've had 10 cortisone injections for my heel pain. And so I'm starting to see that trend, but I foresee in the next several years that a lot of these, private offices like yourself and mine, where we're probably going to head towards more direct care, because that way I don't have to stress about the administrative burden. I can totally focus on my practice, help my patients the way I want to practice. I don't take a lot of insurance, or, I take a few plans, but even with those few plans, the administrative burden on my staff is insane. I mean, absolutely insane. Instead of, me educating the patient on their upcoming surgical procedure with me, I'm in the room educating them on what their deductible is, what their copay is. I'm spending 35 minutes describing what that is to them versus, I could spend that time talking about the procedure, upcoming procedure. And it's just, the script is so backwards right now. And I really do see a big trend in direct care model, and it's going to save people money, and it's going to just sort of help, I think, the whole country as a whole. It's almost like, if you look at Canada, for example, they're like on a socialized medicine model, right? And if you want to see a provider, you can either wait 3 years or you can just pay them cash to go see them. I have a mentor in Toronto, and it's funny because he'll have patients that come from like the traditional model, meaning they'll see a foot and ankle surgeon or orthopedic surgeon over in Canada, and their surgery will be booked 3 years from that consultation. Do you really think that same procedure is going to apply to that patient 3 years later down the road? For anyone that doesn't know this, like in my world, foot and ankle problems, bunions, hammer toes, these things are what we call a progressive disease, meaning they get worse with time. So if you come to see me and I say, look, we're going to do X, Y, and Z for you, but I can't do your surgery for 3 years, X, Y, and Z is going to be completely different 3 years from now. Does that make sense? It baffles my mind. So now they can just go ahead and, you know what? I can't wait 3 years. My foot's in a lot of pain. I'm going to go pay this doctor now to go see him, and I'm going to get my surgery done next month. I don't know if that's the model we're going to run into. I don't know, but
yeah, I think that it'll be interesting to see what happens in terms of where we go as a nation with that. And I think that and again, not to make this political, but it's one of those things where, as long as the corporations have a say in how legislation is written, we are going to be at the behest of these insurance companies. That's just the truth. I mean, I think, President Obama had a good intention with Obamacare, as an example, of providing care for everyone. However, the execution of that plan was not that great, because if you look at the individuals that were at the table formulating that plan, it was the insurance companies.
Oh, yeah.
They wanted a say in terms of how things were going to be done. And so, and when you're in politics, then it's just like that. That's the word itself. It's politics. It's the, and that's why I don't really dabble in that world, because I don't think it helps people that I want to help. I'm here to help people, and that's why I went into medicine. My father's a doctor, my brother's a doctor, my wife is a doctor. I've been surrounded by this my whole life. My mom is a passionate home remedy provider in terms of things that we kind of know from our mother country of India, in terms of Ayurvedic treatments and things like that. Again, things that really don't cost a lot of money. In terms of if you look at how much money is spent on certain anti-inflammatories, could we do a better job by educating people on things like turmeric, curcumin, or even CBD, or things like that come from nature, that arguably do have cellular mechanisms, but the pharmaceutical companies aren't able to monetize on that. Even if you look at even the weight loss industry, for example, and what has emerged with GLP-1s, with things like Ozempic, Wegovy, which are known as semaglutide, or Mounjaro or Zepbound, which is known as tirzepatide. I mean, we have a program for GLP-1s in our office, but patients have to meet with our health coach and make sure they're following their plan accordingly. But if you look at the classification of that drug, it's a peptide, okay? It's just a chain of amino acids put together. That's all. It's really not that fancy. So like if you were to rearrange the chain of amino acids you get from let's say a piece of chicken or the protein that's found in milk or other things, those are also kind of peptides. Or think of like when people buy collagen, right? They're buying collagen peptides, right? These are chains of amino acids that really don't have yes, there are some side effects. And obviously if the dose is incorrect, patients can have an adverse effect. And I'm not down-regulating that, but comparatively to other pharmaceutical drugs, there are way less side effects with peptides than the pharmaceutical other options. And so it's interesting because recently the FDA has actually restricted a lot of the injectable peptides that are on the market, like BPC 157 or other things that we know that are extremely anti-inflammatory and have an effect to help people.
Yeah.
So I think that the question is really about, and I almost want to say that every politician, every person who is hired by an insurance company should take the same oath we do. You're in the business of taking care of people.
Yeah.
When you get elected to office or sworn in, you have to take an oath that you will protect or defend the country against foreign and domestic threats. That's a line in the oath. But there should also be an oath that says we will not do any harm. We will do what's in the best interest of our patients' health and well-being. Because if they're not healthy, they're not living their lives accordingly to what their potential is. I mean, if you look at, again, not to diverge from medicine, but historically, I mean, think about the pursuit of happiness, right? In terms of what's written in our nation's documents that our forefathers wrote, that we should have the pursuit of happiness. But if you're not healthy or you're not well, how can you pursue that happiness?
Where's the happiness?
Right? So that's where I think that we need to really kind of use our outlets, use social media, use these tools we have to get the attention.
Like we're doing right now.
Yeah, exactly.
Like we're doing right now.
That to get the attention of people who should be taking care of their constituencies and making the decisions to allow them to do the right things for them and to seek out practitioners like you and I or other individuals around the country to get their maximum well-being, because then they need the least amount of prescription drugs. And we know that as individuals age, polypharmacy is huge in terms of the number of drugs that an elderly individual may be taking, or even not that elderly, where they may be on 3, 4, 5, 6 prescription drugs. And then once that happens, the side effects and then the multiplicative effects of those medications can also have other issues too for them. So I think, kind of getting back to where we began this discussion about insurance, I think insurance is, it's great for when the rainy day happens, you have an accident, you have to get like a cardiac cath done, or you need surgery, or you need life-saving things and cancer care. But,
right.
But otherwise, I think a lot of other things can be done.
Well, hopefully, with preventative measures, your patient doesn't need a cardiac cath, right?
Yeah, exactly. Exactly.
But yeah. So, let's segue a little bit, because I want to talk more about, how our practices are, truly different from, the guy next door.
Yeah.
You definitely, alluded to some of the things, but tell me, what truly makes, your practice unique to a patient. So patients watching this right now, what's so unique about your practice? I know what's unique, but I want to hear that. I want them to hear it.
Well, I think growing up in a doctor's household, I saw my dad take care of patients around the clock, and, I think that's been instilled in me from a very young age to help them out, right? Whether it's on the aesthetic side, whether it's on the functional integrative medicine side, like for example, if somebody even comes in for Botox, the next day they're getting a text from me and say, hey, how did that treatment go for you?
Yeah.
Looking forward to your follow up in a couple of weeks. that connection, that doctor-patient relationship.
They love that.
Yeah. And I think that's the unique feature of our practice. It's not so much so a drive-through where it's, hey, just come on in and get your Botox shot or your semaglutide shot and, see you later. It's not that form at all. We are, if I was in the business of making money, I wouldn't do what I'm doing. There's other ways of making money.
Oh my God. If anyone's
you know.
watching this, sorry, I don't mean to cut you off, but I just need to address this right now.
Yeah.
If you think in this day and age you're going to get rich being a doctor, please do not go into this field. Sorry, go on.
Yeah, no, I agree with that 100%. I mean, it's a lot of work. It's a labor of love, is the way I define it, and I think that it's a matter of that we care about the patient's success, because if they're successful, then that means that we've done our job in terms of, and success is variable. I mean, it could be that somebody wanted to get to a certain weight. Somebody wanted to solve one thing, but then now we realize it was actually something else that we had to look at.
Sure.
So it's, and that's where that continuous conversation occurs. I'm actually reminded of something that I was told by a neurosurgery attending that I had as a student and as a resident when I was in training, that he said that in ancient China, that and don't quote me on the accuracy of this, but the healthcare system used to be, you keep paying your doctor. The day you get sick, you stop paying your doctor. And then your doctor goes to work to make sure that you're healthy again, and then you keep on paying your doctor.
Mm-hmm.
So it's almost like, we should be empowered to make sure that we are actually curious to get the patient to be healthy. Right? Like that should be our goal as docs, not to just say, oh, I wrote the script, I did my job, see you later. That's a very much so like, I might as well just be like, doing something else in my life then.
But that's unfortunately, that's majority of doctors' offices right now.
Yeah, because that's again, it ties back to the system.
Yeah.
It ties back to the system of, and I know, like, there is the honest truth that a lot of people go into medicine because it's a safe career, it's stable, it has a respect in the community, et cetera, et cetera. A lot of things that you and I have heard of in the Indian community growing up and whatnot. And that's actually not why I went to medicine. I went into medicine because I thought it was actually really cool to take care of somebody's human body. I was very fascinated by the anatomy, the physiology, and everything else. But I think, to kind of go back to your question about what makes us that different is that you're not just getting me, you're getting the impressions that I've had growing up in a household. You're getting the conversations that I had at the dinner table with my dad telling me about cases and my dad's 82 and he's still practicing.
That's
so
amazing.
That's a half a century of data that I have absorbed from him. That's, over a decade of my brother practicing, over a decade of that my wife has been practicing, and all my friends, like even you, like I have, like you're getting the network that's been built into me and to my practice when you come to see us. You're not just getting, a script for something or a diet plan. You're getting that insight. If I know somebody regionally or locally, regionally or nationally or internationally, because also the beauty of the training is that when you train in functional medicine, you're exposed to people who are training from all around the world. In integrative medicine, I have contacts that are in Ireland, in Dubai, in India, because they were my co-fellows in my class. So I'm able to tap into several different pools of professionals and healers to help people out if I don't have that answer.
I love
that. So
that's awesome.
And I think that's the value proposition is that you're getting that experience through that.
No, we need more of this in our country, and just overall globally, we need more people like yourself. That's incredible. I've never actually had anyone actually say it like that, because similarly, of course, my dad is a veterinarian. He's an animal doctor.
I know, he treated our dog.
Yeah. It's true. Hopefully your dog's doing okay. How are we doing on time, guys? Good. We're okay. We got 38 minutes. Okay. Yeah. Sorry. No, so I got into this field foot and ankle. Very similar. Yeah, just come on in. Come on. It's fine. Come on.
Yeah.
push it. Coming in. I got in this field because I truly saw how gratifying it is to help someone's limb deformity and what have you. But I was with an orthopedic group for a while, a few years after my fellowship, doing major reconstruction on patients, doing some incredible surgery. But the one thing that really got to me is that sort of post follow-up, that surgical follow-up, where patients were off their foot for 6, 8, 10 weeks, and everything went great, surgery went great, but one thing I noticed about my patients was that they were really depressed because they just couldn't use that limb. And I never could resonate with that. I just didn't really understand that concept, and then going through my training, it was just one of those things where it was just expected that the patient would be off the foot for that amount of time. You put them on some sort of blood thinning agent to prevent a DVT and this and that. But, it started to weigh on me, and I would do procedures, per the X-ray, follow-ups, things are going great, but that patient was still in a lot of pain. The patient was, like, from a mental perspective, they were just depressed, and it was weighing on me a lot. And it started to create a burnout for me almost. And, I was a couple years into my practice, and that's kind of when I fell into this different technique known as minimally invasive foot surgery, where I basically take. I don't call them incisions anymore. I make a little poke, and I'm able to correct the issue at hand. But the greatest thing about this technique is that the patients get to walk the same day.
Wow.
And
unbelievable.
Yeah. And so that right off the bat was a game changer. I started to implement that at the orthopedic group, and I saw right off the bat that my patients were happier. Happy patient, happy doctor, right?
100%.
Could you resonate with that?
Oh, I mean, like, there's nothing better than, at the end of the day, we're all human beings. Okay.
Right.
And I'm not going to say that you're, and we all are born with an ego, and I think that's good. And because the ego actually keeps you going, and it keeps you going to do the things that you want to do for your patients, or whatever kind of line of work you're doing, as long as you're doing right by your line of work.
Right.
And I think that the ego is actually a great survival mechanism, because when you get that positive result, when you get that positive feedback from your patient, that, hey, or a text message, one of my favorites thing is like, when I see like a Google review pop up where where I didn't even expect it coming,
right,
or that's 5 stars, where somebody gives almost a paragraph or 2 paragraphs. I'm like, oh wow, where do they have all this time to write this? Like, about how great their experience was with us. I mean, you feel there's no amount of money that can replace that feeling, that that somebody's life has been positively impacted, or where you get that text, or where even somebody tells you in person that feedback, or on your patient portal, they write a nice note about that process.
100%.
I mean, it's just an invaluable feedback from them that keeps you going. And you're like, okay, I know that I can do this for this person. Let me do this again. Let me do this again. It's almost like the Tom Brady effect, where, I mean, sorry, Patrick Mahomes last night. That was not exactly his best night, but being Super Bowl was last night. But that's the same thing that I think that those high performing individuals, whether you're CEO, or you're a guru, or you're a athlete, when you start to see that okay, what the work I am doing is producing a positive result,
it's momentum.
Then it's momentum to say, okay, let's do this again. Let's do this again. How do we do it better? Let's go again. And because then it's self generating that energy. And then, I get to meet people like you. And we all get to have this great career by helping our patients, who then allow us to have that feedback, overall.
100%,
So
100%.
I think that, going back to your story of minimally invasive work, I think that's kind of the future. I mean, I think even if you look at even in like urology with, robotic work and things like that, I think even in what I do, I don't operate.
Right.
If somebody wants a facelift or a rhinoplasty or a neck lift or some other facial plastic surgery or any kind of plastic surgery, I refer them to partners that I have in Michigan and elsewhere, but everything I do is minimally invasive.
Yep.
For that reason, because you're seeing, same day result where they're, getting to where they want to be.
Right.
Yeah.
And that, again, I had the same conversation with another colleague, and, this day and age in 2025, everybody's trying to look their best. And I'm seeing it across, surgical specialties, again, whether it's plastic surgery, orthopedic surgery, neurosurgery, everything nowadays is becoming minimally invasive, right? And what does that even mean? Minimally invasive is just exactly what it sounds like. It's correcting whatever the problem is through a very tiny incision. And there's a whole host of advantages to doing it that way, right? And in my space, foot and ankle, we have the same thing where, I just mentioned DVT, right? Blood clots. That's a life-threatening type of disease pathology, if you will. We've completely eliminated that from our patients because they get to walk the same exact day. And again, coming from more of a mental type thing, right? You take for granted your body parts. I broke my finger a few months ago playing football. I couldn't operate for 6 weeks.
Wow.
I was not happy.
I'm sure.
I had 3 screws in my finger. And for 6 weeks, I could not operate. And I'm like, oh my God, this is exactly what it feels like to be on the other side now. I can't use this limb. And again, I couldn't imagine not being able to use my leg for 6 to 8 weeks, 12 weeks. And that's how foot and ankle surgery is right now. So, kind of looking at a traditional approach versus, I don't want to call it the modern approach, but the minimally invasive approach, right? Is, I have a bunion. I'm going to go to the doc. I'm going to have a big incision, and I am going to have plates and screws placed. And then the expectation is for 6 weeks you're off your foot, followed by some maybe placing them in what we call a cam walking boot, followed by physical therapy, followed by getting back to regular shoes again. And after you go through that process, it's almost a year. It's almost a year until the patient is actually able to feel like themselves again. With this technique that we utilize, it almost eliminates all that. I get my patients back to shoes within 3 to 4 weeks after a major bunion surgery. Everything's done right here in the office setting, so there's no need to go to a surgery center or a hospital where there's a lot of disease in those areas already. Here, it's very sterile. Everything's done under a local anesthetic. They're awake, and everyone's like, "Well, how the hell are you doing surgery while you're awake?" It's done. It's done under a local anesthetic. Patient, I correct the big deformity right off the bat. The patient sees the results right then and there, and I'll tell you what the most gratifying thing is in what I do. Seeing that patient's face, that they've had that bunion for 30 years and it's gone through a tiny little poke. I kid you not. I've had multiple patients say, "You're a magician." I'm like, I'm not a magician by any means. It's just that these techniques really, really help patients. And that's what's gratifying for me. And that's why I built this practice. I was like, you know what? I'm done with the big open surgery. I'm gonna utilize this technique, create a whole practice, and see how many patients I can help with it. And it's definitely an incredible feeling. You referred a patient over to us. She's one of my best patients now.
Oh yeah.
She's great.
She's wonderful.
She's great. So, I want to ask you what, there's obviously some similarities in our practices. I try to be holistic also. I'm not a big pharmaceutical type of guy. By the way, with my surgery, I don't prescribe any narcotics. At least I help myself. I try to help. I try to not prescribe narcotics. Let's put it that way. Maybe a few tablets of Norco to help with some breakthrough pain, but most patients are typically maintained on like a Motrin or like a Tylenol. What kind of crossover do you see between us after just this small little conversation here?
Well, I think that, when you think of aesthetics as well, too.
Oh, yeah.
When you look down at your feet, and somebody's investing, in, let's say, a pair of shoes that's a couple $100 or maybe even more. Yeah. Interesting. My daughter was with me at the mall last 2 weeks ago, and she ended up walking into Christian Louboutin, and so because she liked the colors, right? And so I saw the pricing, and I was like, oh, that's interesting, and so. When people invest in their shoes, right? People are talking about their sneaker game, their shoe game, or they're going out, or they're getting ready for an event. They're making an investment in their shoes, right? Yeah. And then, but what goes in the shoe? It's your foot. And so the foot also has to be primed to enjoy that experience as well. Otherwise, then, you have, I think somebody just posted a video who's big in the health and wellness world. I can't remember. She was like showing that, if you're going to be wearing the heels tonight, ladies, put the icy hot on, so it doesn't hurt as much. And I'm like, oh, that's interesting. So I think the aesthetics of your foot, if you look down and you're like, oh, it looks great, and then it feels great. So, and that's where I see the connection between our practices, because there's this concept that also if your like toenails aren't where you want them to be, we actually have some laser protocols where we can help people with like toenail fungus, and things like that.
So do we. Yep.
And I mean, not that that's something that we do a lot, but if it came up, we're also, looking at, concepts of, brittle toenails. If you're seeing that in your practice, I'd want to know about their nutrition values. So we can run those specific tests where we can look at a micronutrient panel and say, well, what's going on here? With that patient. And I think also that, with this concept of longevity overall, and I think that's where somebody coming to you obviously is interested in their longevity, because if they can't move, their longevity is limited. Somebody coming to me, if we notice in their physical exam that maybe they're not walking as well, they complain about their foot, we can then send them to you to help them improve their longevity.
Yep.
So I really think that, to me, it's this combination of, if I were to kind of, as I've been talking to you, thinking about it, kind of like synthesize it down into this concept of where your feet are kind of the root of the tree of your life, right? In terms of, if that your feet are doing well, then you will do well. And if you do well, then your longevity is boosted.
Yeah.
And then you're going to be able to look and feel the way you want.
That's absolutely correct.
And so, I mean, even being here in Metro Detroit as a motor city, I mean, like, you got to have good tires. And some people like their rims to look a certain way, if you don't have good tires, your car's not going to go very far. So, it's a very, I think, synergistic relationship in terms of what you're doing and what we're doing overall.
Yeah. No, I 100% agree. How are we doing on time, guys?
51 minutes.
We talk a little bit longer?
Yeah, we got about 5 minutes.
All right, cool.
Yeah.
No, I completely agree with that. I want to just quickly talk about this term regenerative medicine, because it's been a hot topic. I do a ton of regenerative medicine. It sounds like you do a lot of regenerative medicine. What is regenerative medicine in your practice?
Okay. So I think there's kind of the regenerative medicine that exists in terms of technology, right? In terms of whether you're talking about peptides, whether you're talking about stem cells, you're talking about PRP, which is platelet-rich plasma, or platelet-rich fibrin, exosomes. Even now you look at PDRN, which is polydeoxyribonucleotide, which is derived from salmon or salmon sperm or even tuna sperm from South Korea. That's a big, kind of craze too. And this whole kind of regenerative or biostimulatory concept, even on the aesthetic side, where using things like calcium hydroxyapatite or polyallactic acid, which is Sculptra, calcium hydroxyapatite is Radiesse, to help to regenerate collagen for people to get tighter skin or volume replacement in certain parts of their face, especially like temples, jawline, mid-face, things like that. So these are a whole host of things that we can do, even things like simply even microneedling that is causing these micro injuries in the skin to then regenerate collagen, or even radiofrequency, or even laser. So there's this kind of technology arm of things that we can use to create regenerative techniques. And then there's also kind of using ancient techniques that we know in terms of looking at, are we regenerating our microbiome the right way in terms of the foods we're eating, making sure we're getting that prebiotic fiber in our diet, variety of fruits, vegetables, and eating the rainbow, that's regenerative. Looking at things like even fasting, keeping some time between your last meal of the day and the first meal of your day. That way your body has some time to regenerate its gut microbiome. It also has time to address any kind of incorrections in the cellular structures, in the DNA. It's almost like the cleanup crew has an opportunity to come in. If you have the cleanup crew coming in during business hours, it doesn't work.
Right.
So you almost have to be closed for business or fasting for the cleanup crew to come in and work. So that can be very regenerative. Or even things like hot and cold exposure, things like sauna or cryotherapy, cold plunge, which is becoming the big craze too.
It is.
Everybody's getting something or another installed in their house. So, it depends upon where, and I could go on about this regenerative medicine
We might have
concept.
to have
Yeah.
like another
And I think we
complete
should.
podcast on just regen med.
And I think we should
Yeah.
as kind of a intro, as a teaser for next time.
Yep.
But I think that regenerative medicine is based upon what the patient wants to regenerate.
Mhm.
And I think that the regeneration also starts with a thought. And that's because the patient has to think differently than they have been.
Yeah.
They won't change until their thought process change. Once the thought process is regenerated, everything else now can become a discussion.
That's awesome.
You know,
That's a great way. It's a
So
great way to look at it.
That's the way I look at it.
That's pretty powerful. That's
Yeah.
awesome. I completely resonate with everything you're saying. I just when I talk to patients about regenerative medicine, I kind of just say, look, your body is very smart. It knows what it needs. We're just going to give it a little jump start, and let's let science just take over at that point. Let's just let Mother Nature take over instead of me pumping you full of medication that is going to have side effects, like cortisone. I mean, a lot of my patients that come to me for aches and pains in the foot and ankle, they go see 2 or 3 other docs, and they've been loaded up with cortisone. And you and I both know cortisone has a lot of side effects.
Yeah.
It's usually a Band-Aid approach. I use a lot of what's known as Wharton's jelly in my office.
Yeah.
I've used some PRP in the past, but one thing I've come to learn, especially with musculoskeletal type injuries or even like post-surgical, PRP, after a certain age, those growth factors, those, mesenchymal stem cells that are in there, they're just not as great as they used to be. And what I love about Wharton's jelly, and do you guys use Wharton's jelly?
Not currently.
Okay. So what I love about Wharton's jelly is that, we're getting for those that don't know what Wharton's jelly is basically the cushioning around the vessels inside a umbilical cord in a live healthy baby. And that cushioning we can actually take, and just to preface this is coming from live healthy babies. Patients always ask, are these babies aborted? They're not aborted by any means. These are very healthy babies. And the cells in the Wharton's jelly has a plethora of what we call mesenchymal stem cells, growth factors, exosomes, cytokines, growth factors. And if you look at the concentrations of Wharton's jelly versus PRP, let's say like a 60-year-old, it's just night and day. Right? Yeah. And a good analogy to use is when you were 5 years old, you could go cut yourself, and you'd be healed the next day. If we go do that now, I trip and hurt myself, it'll take 3 weeks for me to heal. Why is that? Because our efficiency as we grow is just not as great anymore. So instead of trying this PRP on a torn ligament, I hit him with some Wharton's jelly, and the patient heals almost as if they were young again. So anyways, I think that's a great topic for next time. But this was a lot of fun. Can you tell everyone how they can reach out to you, or what are your socials?
Sure.
How can they reach out to you?
So on Instagram, we have two handles, at Grover Aesthetics and then also at Grover Health. And then if you are interested in an appointment, send us a note to info@groverhealth.com. And then our phone number is 248-403-8388. We are on Maple and Telegraph in Bloomfield Hills, 4050 West Maple Road, Suite 201, Bloomfield Hills, Michigan, 48301. Yeah.
Nice.
So
nice.
Multiple ways to get a hold of us. We check everything every day, multiple times a day. So happy to help anybody looking to feel their best and look their best.
Go see this guy. This guy's awesome. And then for us, if you want to follow me on Instagram, Dr. So Dr.Wadehra, Wadehra. I have a second handle. The Art of Foot is our other. Sorry, The Art of Foot and Ankle is the other one, and theartoffoot.com is how you can book appointments with us. So, thanks for doing this, man. This was fun.
No, absolutely. Thank you.
I appreciate the opportunity. We have a lot more conversations that I'd be having.
Yeah, thank you. This was a beautiful setup and awesome office. Yeah, thank you.
Thanks.
Yeah,
Awesome.
Thank you.
Cool.